Hello everyone, my name is Samira, and in this presentation I will be discussing the effective use of digital innovations like Geographic Information System or GIS map that has the potential to improve data-driven decision making, planning and program implementation. I'm also going to talk about the impact of GIS map on improving routine childhood vaccinations for hard-to-reach populations in the United States. This includes careful planning and execution across several key areas. So let's start. So in the US, the routine childhood vaccinations has dropped significantly, which is leading to lower immunization coverage and increased risk of vaccine preventable diseases. So certain hard to reach populations, they face systemic barriers. For example, people who are actually living in rural areas or low income families, specific racial and ethnic minorities, or those with limited access to healthcare. Uh, because of them, there is a continuous decline in the childhood vaccinations. So the solution here is to explore how this GIS or Geographic Information System maps can be used as a powerful tool for identifying and addressing these coverage gaps. So in this chart, you can see childhood immunizations in the United States. These are the requirements where vaccinating children according to a recommended schedule is one of the best ways to protect children from harmful and potentially deadly disease like measles, mumps, rubella, polio, and many more. As you can see in the chart, the recommended immunizations for children from birth through 6 years. So what is the issue here? There is a critical drop. The vaccine coverage for many routine childhood vaccinations, this has started to decline in the recent years, especially the young children. These inequities in this rate, in this childhood vaccination base, these are documented by the CDC based on factors like race, ethnicity, and poverty status. This also creates concern for public health experts who worry about outbreaks and loss protection for the most vulnerable. Now, to combat this challenge, Geographic Information System or the GIS map, it has emerged as a valuable tool in addressing these disparities. So, what is GIS? It is actually a framework for gathering, managing, and analyzing data using spatial location. It presents the complex data as interactive maps, making patterns and relationships which are easy to visualize and understand. This in turn actually help the health agencies to identify areas of low vaccine coverage so they can plan effective interventions and track progress over time. Let's see some of the historical context of GIS in the public health, which they have used earlier. GIS in the early use, as you can see in it is used as a disease mapping. One of the best example I can tell you here is in 1854, Dr. John Snow, he used to track cholera outbreak in London. Now, with the advent of more computer technology, this has evolved to integrate vast amount of data for advanced spatial analysis. Now it is used for disease surveillance with the expanded applications uh, and to manage the outbreak and also for better health service planning. Identifying the missed population, as you can see in the chart, there are a number of states with exemption rates in the select group by school year. So this trend, it actually has begun during COVID-19 pandemic and has continued through 24 to 25 school year, which is leading to approximately 138,000 kindergartners which are being exempted from one or more vaccine. This whole bar represents the 50 states. So with the help of GIS, we can actually identify the most vulnerable population, which are located state-wise. In this map, you can see the percentage of children receiving vaccine. For example, for the kindergarten vaccines, who has received MMR during the 2023 and 2024 school year, they have shows 80%, less than 80% in Idaho, and between 80 to 85% in Wisconsin and Alaska, and also the rest 85 to 90% in Utah, Colorado, Nevada, Oklahoma, and Minnesota, and so on. In this map, you can see the percentage of children which are claiming exemption. Again, in this year, Idaho stands first in place with more than 12%, then followed by Utah between 9 to 12%, and then Oregon, Nevada, and Arizona, and the less orange colored states. So based on this information available, GIS actually help plan the best routes to combat which neighborhoods are at highest risk. So so the health departments can place temporary clinics in community centers, schools, or the places of worship where coverage rates have shown the greatest needs. Studies shows that lower vaccination coverage has actually occurred in areas that are not near a vaccination facility. So there are also several factors that contribute to reduce vaccination rates among our hard to reach population. They have very low accessibility. Physical distance from the healthcare providers have actually limits the access to regular childhood visits where vaccines are given, and also limited transportation options often make attending appointments difficult, especially in rural settings time. And the other socioeconomic factors like here the insurance status plays a major role with uninsured children are less likely to complete the vaccine series, and the communication barriers like the cultural misunderstanding or the historical mistrust may have caused families to avoid or refuse vaccines offered by the clinics. Now, to address these problems, the health departments need to target or make strategies that go beyond general public messaging, and they need to identify where coverage is lowest and also understand who remains at risk so they can provide improved immunization rates nationwide. One thing they can do is they can optimize the reach and provide a good resource allocation. So based on the information available through the GIS map, it can plan the best routes to combat which neighborhoods at highest risk, and they can set up the mobile clinic. So for example, for communities with poor access, GIS can actually identify optimal locations where the mobile clinics or mobile vaccination units can be placed. So, so it is more efficient for the mobile teams. Empowering, second thing they can do is the empowering communities with most accessible information. Um, so this maps actually allows the health departments to create targeted and hyperlocal communication campaigns with community organizations like religious groups and local leaders in specific areas, and also to deliver culturally relevant and trusted vaccine information. They can actually, this is the example you can see, this is for the Illinois, and this is the dashboard. A vaccine locator tool can actually help families find the nearest clinic or pharmacy, or they can actually look for hours of operation and even make an appointment availability very easy for them so they can be accessible. So next is data and technology integration. By now we know how GIS works, as it turns the complex data into interactive maps and dashboards, revealing patterns and relationships that are otherwise hidden. In the previous slide, we have seen a sample of the GIS dashboard. It displays metrics like vaccination um, rates over time, appointment completion rates, or some of the other coverage goals. With data and technology integration, the CDC VaxView system, which is also a powerful resource that provides geospatial data to inform, plan, and evaluate vaccines or other activities. And the other data sources we can collect data from is about the immunization information system or the state registry and other census data, and some other are like socioeconomic indicators. And on the dashboard, you can also see real-time tracking where it provides real-time updates on vaccine inventory and administration and enhancing situational awareness. So how we can further monitor with these GIS dashboards. So the public facing dashboards can actually keep the stakeholders and the public informed about the progress of vaccination efforts, which actually kind of helping build the trust in the community. They can track progress towards immunization goal and monitor how equitably vaccine resources are being distributed. So decision makers here can get a live view of the vaccination effort, which actually allow them to respond quickly to changes and resource needs. Some of the examples here, one is the case studies we can go through is how they have implemented the GIS and what are the outcomes. One is at Texas Children's Hospital. Uh, During the COVID-19 pandemic, this hospital has used the GIS dashboards to visualize vaccination rates and also prioritize vulnerable populations and track distribution. This approach actually helped the local health departments to match the vaccination sites with priority population and also fill the coverage gaps. Similar strategy has also applied by Carleton County, Minnesota, where they have successfully applied for seasonal flu vaccine campaigns. They have demonstrated the replicability of the GIS approach, which resulted in significantly higher vaccination rates compared to the previous year. So as you can see, the GIS guided innovation has made the best use of limited resources. So we can target vaccines where they will have the largest effect, and it also eventually saves the public fund in all throughout the process. So raising vaccination rates has not only served underdeserved community, but also it benefits the whole as a society, because higher rates of immunization will establish the herd community, which protects those who cannot receive vaccines, such as infants and the pregnant women or those with certain medical conditions. So this outbreak prevention actually will eventually it's beneficial to the society in terms of where we'll have the schools open, which saves family from lost work and also prevents expensive hospitalizations. And it also the community trust also grows when this outreach reflects the diverse needs of the local residents. Actually, when people see public health agencies are paying attention to specific neighborhoods and addressing the barriers, they are more likely to participate in immunization programs. So the conclusion here is GIS mapping encourages collaboration among schools, local governments, and nonprofit organizations and clinics. Everyone has needs to get collaborated to work to improve the chances that every child get will get the vaccines they need. There are some of the challenges and considerations as despite we can see all the clear benefits all throughout the slides, there are some challenges also using GIS technology. One concern is the privacy concerns that needs to be managed carefully to avoid sharing sensitive health information among about the small groups or the individual families. Second is the agencies must needs to rely on the accurate and the current data, because the incomplete or the outdated data can lead to missed opportunities or wasted resources. They also need to invest in staff training to ensure that these maps are interpreted correctly, that results in effective and ethical planning. So in conclusion, GIS has moved beyond one size fits all approach by providing the strategic precision needed to address these diverse factors which are all influencing the immunization rates. With this in a GIS, the public health officials can actually make evidence-based decisions. They can prioritize resources and also strengthen the overall health system.